health restrictions. Are there any plans to look at increasing health restrictions at this stage? I know you're extending them, but I think we've seen Ontario, BC, Alberta take, and even Manitoba yesterday take more drastic measures. And some of those provinces have higher per capita or lower per capita cases than we do, and lower new cases per capita than we do.
Dr. Shahab, maybe just a couple of words if you want to comment on that as well. Of course, more than welcome. With respect to the hospitalizations here in Saskatchewan, yeah, they're higher than I think anyone would like to see them. In particular, here in Regina, we do have provincial healthcare capacity, although with the concentration of variants of concern here in Regina, we do have significant pressure, I think would be fair to say, on our ICU here in Regina, as well as the healthcare system here in Regina. As Dr. Shahab had said, those variants of concern, the UK variant hasn't been moving across the province throughout the north as maybe quickly as he had expected, which is a positive thing. But we do need to keep an eye on our healthcare capacity, most certainly, and we are keeping an eye on that. And ultimately, the path through this, and I use the North Dakota example, is for us to continue to encourage folks to, one, follow the public health measures that are in place, and I think by and large people are continuing to do that. And I would just ask once more for them to pay particular attention to the public health measures that are in place at this point in time. It's likely one of the most crucial. The next couple of weeks are probably some of the most crucial time that we have been in the COVID-19 pandemic, in particular here in our capital city and the surrounding area. And then the second piece is the second job that we all have to do is, when it is your turn, go out and receive the first vaccine that becomes available to you. They're all effective. They're all safe for your age category. And ultimately, the way for lower hospitalization numbers is for us to continue to provide and accept those vaccines into the general population. Dr. Shahab, any more on that topic?
Yeah, so obviously this is something we continue to watch very closely, and we did extend measures that we had in place prior to Christmas. No household bubbles, worship sizes capped to 30, and all other measures throughout Saskatchewan are in effect, and of course tighter measures for Regina. Regina, like the Premier mentioned, our cases have plateaued. They are not continuing to go up, but they are still generating significant hospitalizations in younger cohorts, which again is very hard. I think while deaths unfortunately do happen and maybe less common, nevertheless, it is not a trivial thing to be hospitalized and to be in ICU at any age. So obviously that's a concern for Regina. We've seen the rates of concern increase in southern Saskatchewan. They don't have the same orders that Regina has, but we've seen how, in many cases, businesses, restaurants themselves have been promoting takeout and curbside pickup. Individuals have been reducing, the number of contacts when they're out and about grocery shopping. Again, we have to be really watchful for all workplaces, especially essential workplaces, really improving COVID protocols. All those measures are having an impact. Saskatoon, we are very concerned because the proportion of variants of concern in Saskatoon is now, at around about half of the variants of the cases in Saskatoon are variants of concern, around 40%. So again, so while Saskatoon has seen a relatively stable case number, or around 40 to 50 a day, and test positive is 5.6, they really need to stay the course. We don't want Saskatoon to escalate like Regina. And so far, with current measures, it seems to be working. But again, everyone needs to diligently follow all the guidelines. One or two super spreader events, like unfortunately happened in the Southwest, can tip the balance to rapid growth. And so obviously, we are at a critical point right now. On a positive note, vaccinations are accelerating 40 and older, and then people who are more likely to be exposed, essential workforce in many areas. But at the same time, we need to stay the course over the next 4 to 6 weeks at least to keep our numbers as low as possible as vaccines get into arms and have the 2 to 3 weeks post-vaccination that it takes for you to get some protection at an individual level. And each person who is vaccinated protects themselves, protects their household, and protects the community. So I think both these measures are going to be critical.
Scott, would you have any comments on the provincial capacity or not on that?
Well, I think you touched on it, Premier. I just, to reiterate your comments around ICU capacities, we are on bypass in Regina, and those Regina cases in ICU represent 2/3 of all cases across the province. So it's important, as Dr. Shahab and you've already highlighted, how important it is for folks to double down on not just getting vaccinated, but also adhering to all public health orders and getting tested as quickly as possible so that we can follow up on cases and get in front of this virus. If other ICUs in the province start to experience what Regina does, we're going to be in real trouble. And we've talked about that a lot, but it's a real risk for the system, and it's important that people understand that risk.
We'll take another question on the line, operator.